Imagine being able to peer inside the human brain and pinpoint exactly what's happening in real time, whether it's a stroke, tumor, or neurodegenerative disorder. But how do we do that? When it comes to diagnosing neurological conditions, two of the most common tools are magnetic resonance imaging, or MRI, which uses strong magnetic fields and radio waves along with a computer to generate sectional images of patient anatomy, and computed tomography, or CT, which are the recording of a predetermined plane in the body using an X-ray beam that is processed by a computer for display on a monitor. Today, we'll explore these two imaging techniques and their impact on diagnosing neurological disorders. While MRI and CT scans are both widely used in clinical practice for diagnosing, the optimal choice between these two imaging techniques often remain unclear for many conditions. Each method has unique advantages. MRI offers greater detail for soft tissue, while CT scans are quicker and more accessible. This analysis aims to evaluate the effectiveness of MRI versus CT scans, exploring how each can impact diagnosis, treatment, and patient outcomes in the context of neurological disorders. To conduct the analysis, I systematically reviewed clinical data from patients diagnosed with common neurological disorders that compared MRI and CT scan results from these conditions. Studies have shown that MRI can be considered more effective than CT due to its ability to provide superior soft tissue resolution, enhanced contrast, reduced bone artifacts, and volume-related issues. This enables MRI to detect even the smallest metastasis during the scanning process. Another study reported detection of multiple sclerosis or epilepsy in the recruited participants with the help of CT scan and MRI. However, such findings have been reported that MRI provided better results examining the neurological diseases in contrast to other evaluation techniques such as CT scans. Then, another study concluded that MRI and CT accuracy was found to be 84% and 83% respectively, which was consistent with findings. Results show MRI is more effective for soft tissue detail and detecting conditions like metastasis, but both imaging techniques are generally accurate for diagnosing primary brain lymphoma and conditions like epilepsy. CT scans are simply faster and more accessible. This research holds significant potential to transform how clinicians diagnose and treat neurological disorders by providing a clear, evidence-based comparison of MRI and CT scans, empowering healthcare providers to choose the most appropriate imaging methods for neurological disorders. I encourage clinicians to continue exploring the evidence, apply these insights in clinical practice, and advocate for better diagnostic accuracy to improve patient outcomes. Together, we can ensure that every patient receives the most precise and effective care possible. Imagine being able to